to today's episode of the Psychology of Black Womanhood podcast. We're diving into the importance of using a positive sexuality lens when exploring the experiences of Black women. For centuries, Black women have faced harmful objectification, stereotyping, and negative messaging that shapes how our sexuality is viewed by society. In this episode, we'll explore the concept of positive sexuality and how embracing it can empower Black women, help dismantle those damaging narratives, and promote healthier, more affirming relationships. To better understand what positive sexuality research asserts and how it can be implemented into everyday practices, we're talking with Dr. Shemeka Thorpe, an award-winning sexuality educator and researcher. Her research focuses on the sexual well-being and reproductive health of Black women using sex-positive frameworks and Black feminisms. She has published over 50 peer-reviewed articles and has been listed as one of the top 20 Black sexologists you should follow in BuzzFeed. The work you're doing is something that we often don't talk about, positive sexuality. People come to this with their own positions or beliefs or understandings. But as an expert and someone who does this work and a Black woman researcher, why don't you start off by telling us what exactly you mean by positive sexuality?
Yeah. So when I talk about positive sexuality, I pull a lot from the Center for Positive Sexuality. There are 10 dimensions of positive sexuality. And so some of that includes things such as desire and having the rights to act on our desire, as well as sexual agency. So, of course, there's been decades of research on sexual agency, but how are we looking at agency through a positive lens that includes things related to sexual functioning, such as desire, arousal, orgasms, pleasure, things that are less risk focused. And so that Black women in research, they can see themselves and kind of see some of these positive aspects of sexual exploration, liberation, and freedom.
It's a lot more complex than I think a lot of us think about. And I think about it in terms of the popular cultural narratives around positive sexuality. And we see a lot of discussions and the presentations focusing primarily on the right to do what you want to do when you want to do it, which I understand is part of it. But what are some of the gray areas you often encounter when you're setting the stage around this work of positive sexuality?
Yeah, so I think there's a lot of gray areas, honestly. And so most of the papers that we've been writing recently have focused on those gray areas. So, for example, I have a lot of research on sexual pain. And the reason why I ended up focusing on the sexual pain of Black women was because as I was exploring their experiences of sexual pleasure and their barriers to pleasure, a lot of it was related to the pain that they were experiencing during sex. So it wasn't necessarily pleasurable, and they couldn't focus on this positive aspect because they were experiencing pain, or maybe there were some other psychological aspects, such as having like sexual anxiety or feeling sexual guilt based on religion and religious trauma. So there are several gray areas that definitely come up. Another one I think about when you said that, like, everyone's like, oh, just go have sex. It's not that simple. A lot of times it actually makes people feel pressured to have sex before they're actually ready to have sex, whether that be with a committed partner or someone they're having casual sex with. And I hear this a lot with the college students, especially when I teach undergraduate students, where it's kind of this pressure to have sex. So it kind of engaging in what we would consider in research to be like unwanted sex. So it's consensual, but they don't necessarily like want to engage in it. It's kind of this social pressure or fear of losing a partner that kind of impact their decision making around engaging in sexual intercourse. So there's definitely a lot of gray areas. And so I think that leaves room for exploration and for storytelling, but definitely it's not as clear cut and black and white as people make it seem.
This is somewhat radical in terms of how the research usually frames Black women's sexuality. As researchers and educators, we're trained to focus on outcomes, and primarily negative outcomes like sexually transmitted infections, unplanned pregnancy, and like you said, consent or lack of consent. But I was wondering, before we get more into your research and your findings, what was your path to approaching Black women's sexuality from this position of positivity?
So I think for me, it was very important for me to find people that were already doing the work to have them as my mentors. My postdoc mentor was Dr. Candace Hargons. And the reason I reached out to her was because she was doing sex positive research. And I cited her a lot when I was writing my dissertation. And so my background is in public health education. That's what my doctoral degree is in. And that is very risk focused. And I was definitely pushing the envelope in my doctoral program by saying I only want to focus on these positive aspects, and this is why it's important. And I think the thing is that we have to realize, yes, sometimes it's pushing the envelope, but people have collected data on sex positive aspects for decades. For instance, I had health data for my dissertation, and there's sex positive aspects about pleasure expectancies in like wave one that was collected in the 1990s with teenagers. So, being able to ask people about their pleasure expectancies and sexual guilt and orgasm frequency through a public health lens, I think is important. And so I've just appreciated the people that have already laid the foundation of that work, because I had that support to show that yes, this is important in multiple fields, because my postdoc mentor is in counseling psychology. So it's just important work that's being done in various fields.
Yeah, I saw that you have this really interdisciplinary training, which I think is a common thread among all the researchers that we've had, is that we have to pull from so many different places to bring together this story that accurately captures Black women's outcomes and realities. So maybe you could share a little bit about some of the research that you found around Black women's sexual health from a positive lens.
Yeah, so I can highlight two studies. One study that we did was called the Big Sex Study, and that was led by myself and Dr. Candace Hargons. And we did a survey, interview, and focus groups the survey was with over 400 Black people in the U.S. And it was a really awesome survey where we had the opportunity to ask Black women about their experiences with masturbation. So we asked them, what are some of the messages that you received around masturbation, how that has impacted their sexual agency now and their sexual self-consciousness. We also have some work that we've done around how Black gender expansive people and Black women define good sex. And so that was really important to highlight, especially since many of the women in those groups were heterosexual, but we did look at the differences between heterosexual and queer women. So all these papers are published. So if you go to Google Scholar and type my name in, it will pop up. But with masturbation, we saw that Black women received a lot of messages in childhood stating that it was bad and they shouldn't do it, and it was a sin and it was ungodly. And then when they became adults, everyone was telling them that they should do it because that's the only way they would learn their bodies. And so a lot of times they were grappling with, how do I unlearn these negative messages I received in childhood. Right. And now all of a sudden people are giving positive messages to me. And so that balance that they were trying to figure out, what that looks like for them. And then in the pain and pleasure study it was a mixed method study. So we did surveys and interviews with Black women from the Southern U.S. So I am from the South. I'm from North Carolina. So I tend to do research with Southern women. So I might be a bit biased. But my research from that, I really wanted to see how Black women defined sexual pleasure, as well as what activities brought them the most pleasure. So we did some research around pleasure mapping, where Black women were asked to map out the activities that brought them the most pleasure. So that paper is published in the Journal of Black Sexuality and Relationships. And in that, we saw that Black women were very interested in things that were reciprocal. That was also one of their top words for good sex in the Big Sex Study. And then we saw in the Pleasure Mountain paper when I talk about this paper, I tend to talk about it like The Price is Right. So I don't know how many people still watch The Price is Right, but like, yeah, The Price is Right.
Yeah.
There was like that little mountain game. I think it's called like
Yeah.
Cliffhanger, where the person would climb up the mountain.
Yep.
And so in this paper, this is kind of how I view pleasure, where Black women are like on the side of the mountain, climbing to the peak of pleasure. And within that mountain, there's certain things that boost them to that top. So one of those things was partnered interactions, having a mind, body, soul connection with whoever they were having sex with. So if it's a committed partner or a casual partner. And the one thing that they reported the least was orgasms, but it was reported, which shows that like orgasms don't always equate pleasure and vice versa. So I love that paper. It's one of my favorites. And then the foundation of that mountain, we see that there's mental components, physical components, and emotional components that definitely impact Black women's access to pleasure.
I appreciate that you actually brought up the regional piece, being from the South. And you also brought up the fact that these women had very different messages when they were children versus when they're older. So there's this generational piece. And so it really speaks to the diversity of Black women's experiences. What do you think are some individual level factors like that that are really important to consider when you're doing work around Black women and sexual health in a positive position?
So I think definitely like region. I think also being in the South and it being the Bible Belt, we have to look at religion. I think that's an important individual factor that has definitely appeared. I think also, making sure that we're addressing things related to previous experiences of abuse and violence. That is something that definitely impacts sex positive aspects. And I think also like SES. So when we're thinking about who has access to like comprehensive sex ed, especially in the South. So comprehensive sex ed versus abstinence only, and knowing that Black girls, like there's plenty of research that shows that Black girls are less likely to receive comprehensive sex ed. So who has received comprehensive sex ed in their lifetime definitely has an impact on their sexual health overall.
One of the things I really want to highlight is that you're not just a researcher. I know that's pays the bills and that's your job, but you also do a lot of education, which I think is important, of linking this academic knowledge and sharing it and disseminating it with the people who really need it and really it's about. So when you're thinking about the topics that you do in workshops for Black women, what are the most common ones that you're asked to talk about or you spend so much time focusing on?
Yeah, we spend a lot of time focusing on communication. I think that that's been a big thing. So especially people that are within heterosexual relationships, just communicating to their partner about what feels good and what does not feel good without bruising their ego or like fear of some type of repercussion if they say something to their partner. It's definitely if there's a power imbalance. We also kind of see similar things when we're talking to Black lesbian women. That's come up a lot, where sometimes those that are masculine presenting don't feel like their partners actually are concerned about their pleasure. And so feeling like they have a safe space to actually say that is a bit of a challenge for them sometimes that we see in workshops. But the thing that I think we focused on more recently is sexual mindfulness. And so I know mindfulness is being like thrown around as a buzzword now, but like within sexual mindfulness, it's often that we see that people are just disconnected from their body. So when they're having sexual intercourse, they're not mentally there, or they're not, they're thinking about something else. So people are in relationships, they might be thinking about like their to-do list or the groceries or whatever else needs to be done. So encouraging people to like do certain exercises so they can be present and get themselves in the mood and mentally ready to engage in sexual intercourse, but also to like feel their senses. And there's a lot of sex educators that focus on that, but that's come up a lot in research. And I'm grateful for my graduate research assistant, Natalie Malone. She's actually a yoga teacher. And so having her help out with those sessions has been tremendously helpful, because a lot of times people aren't using their full senses, especially with Black women, where we're often taught that like we're just a vessel of pleasure for other people. It's hard for us to just sit there and be in our senses and be like, what does this feel like for us?
Actually, I'm so glad you brought that up. And maybe you can define for the listeners, what is sexual mindfulness? Because you're right, we throw around this word mindfulness, it's being talked about. But what are we talking about? Particularly, why is it important for Black women?
Yeah. So sexual mindfulness is like being fully present during sexual intercourse and aware of your body. And so what your body is doing, how you're feeling in that moment, and what it feels like for you. So the opposite of that would be called spectatoring. And so that's when you're having sexual intercourse, but you're thinking about other things. So as I mentioned previously, like the to-do list, or you're just not mentally there, right? It's like sometimes sex might just be a chore. That's like spectatoring. And so we're really encouraging people to like think about how mindful they are during sex. And I think that sometimes that's hard, especially a lot of the work that we do here in Kentucky is with people who are survivors of sexual assault. And so that can be harder. So that's why we tend to focus on that more when we do community-based work, because we know the rates of that among Black communities and among Black women. And so whether people have disclosed it to us or not, we want to make sure that we're giving people the tools they need so they can be fully present during sex and also recognize what is pleasurable for them.
I appreciate that you've also raised points about unique groups of Black women, our diversity. So you talked about queer women or gender and sexual diverse women, women who have experienced abuse or violence. Why is it important to acknowledge these things when you're doing the type of work around sex positivity that you do?
Yeah, I think, well, overall, like Black women aren't a monolith. And I know we say that all the time in research, right? Okay. I read your research and I know you say that. But like Black women aren't a monolith. And so we need to make sure that people understand that we all have different experiences. I think also as a researcher, it encourages me, and I think even the students that are in my research lab, to like check our own biases, our own privileges, and our own identities. Like, yes, we may all be Black women, but we all show up differently in every space that we go into. And so it really challenges us to think about our positionality in the work that we're doing and why we're doing it. And how we may need to adapt certain things depending on what environment we're going into and who we're working with.
If someone had the chance to attend your workshops or work with you, they'd get so much out of it. But you're one person, and like you have these yoga groups and you're in Kentucky. So not all of us would get the opportunity to connect with someone like you or even connect with you alone. Thinking about the big picture, what needs to be done at the community or individual level to ensure that Black women's sexuality narratives can really start centering positive aspects?
I think for me, there's already people that are on the grounds doing this sex positive work. So whether that be sex educators, health educators, sexuality counselors, therapists, like practitioners, people are doing the work. And I think sometimes in academia, like we get stuck in like manuscript writing and writing grants and things like that. But when we collaborate with community partners who are already doing the work, then I think we make a bigger impact in our community. So I'm super grateful for the collaboration that I have with Sister Song Reproductive Justice Collaborative, specifically with the branch in Louisville, Kentucky, and working with Dr. Williams to do some of these groups and disseminate some of this information. I think now there's been more of a push for younger academics to have like some type of social media presence. And so I just encourage people that if you have information, to continue to disseminate it on social media or any way that you possibly can, but also just team up with community partners that are doing the work in your community or nationwide. I think is also important depending on where your research takes place.
So for someone in the community, you're suggesting, I know Sister Song is a national organization or social media. Are those good places for them to start to get more information and knowledge?
Yeah, I think definitely start there. There's also the Women of Color Sexual Health Network. And so if anyone is looking for a sex therapist, a counselor, or educator, you can go to that website and you should be able to find people in your state. If someone is interested in looking, if someone in the community may be experiencing sexual pain, because I know that's one thing I mentioned. The vagina rehab doctor created a list of women of color pelvic floor therapists, because we know that a lot of women of color want other women of color as their practitioners. So it's Black women and other women of color. So definitely check that out if you think that you may want to explore things around pelvic floor therapy.
So if you're in a position where you can take care of yourself, these are great resources. What about in families? What should families be doing in terms of, I saw your face there, like when you're thinking about it, how can parents start approaching this? Or is that something that you found is difficult to address?
I think it's difficult to address. And I think one thing that we see is that parents are approaching it too late. So they're either approaching it too late because kids are learning so much from school, especially if they ride the bus. They're like learning everything on the school bus. So that's a thing. And I think also, like, especially when I was younger, parents were really taught to have like the talk, like this one dreaded talk,
right,
that had to be like all inclusive, right, that was very uncomfortable. But we know that's what's most successful is having multiple conversations. And so there isn't just one talk, it's several conversations that need to happen. And so Sex Positive Families does a great job of having workshops for parents and of kids of all ages. So if someone is looking for workshops, Sex Positive Families does that. They also have great books that will help parents like walk through what is age appropriate conversations. And so I'm grateful for all the work that they do and they have done for the last couple of years.
For you as a Black woman, an educator, researcher, what's your next big thing? What direction are you headed in?
Yeah. So I think I'm still going to continue with some pain research. I'm not done quite there yet. I do want to explore that a bit more and specifically looking at things that are unique to Black women and their experiences of sexual pain. And then also we just completed a study, which I'm super excited about, which is related more to reproductive health and family planning. Okay. So this was one of my dream research projects, and it was called Art for Hope. So assisted reproductive technologies for hope, where we interviewed Black queer women couples about their experiences using art. So either using IVF, IUI, or ICI. And so we did that study in Georgia, North Carolina, and Kentucky, and we're expanding it to Philly and DMV area. And it was just really awesome to do these interviews and do them in person, right? I hadn't done in-person interviews since like COVID. So like doing those in-person interviews, sometimes in people's homes, just to sit with them and sometimes hold their grief for a second or just be with them in community was really nice. And so my hope is to write a book from this data.
So if you could tell Black women one thing they should think about when they're trying to move towards framing their sexual life and sexual health in a positive way, what would you say?
I think I would encourage them to dream. I think so often when we think about like sexual health and sexual well-being and our own well-being and what we want for ourselves, we hear the noise of other people. So whether that be religion or parents or peers or, elders, but just sit there without the noise of other people and think about, what do you want your sexual life to look like? What honestly feels good to you? And what are some things you may want to explore that you haven't explored yet because of the fear or the things that you've heard from other people? So I think I just encourage Black women to like get into a place that's silent and sit with yourself for a second and without these outside voices, just to dream a bit about what your sexual well-being and sexual exploration could look like.
Thanks for listening to this week's episode, which featured Dr. Shemeka Thorpe discussing her positive sexuality research and how to implement this approach in everyday practices. You can learn more about Dr. Thorpe's work and follow her on various social media platforms by going to this episode's page on the Psychology of Black Women website's podcast page. Again, thanks for tuning in today. We hope you found it insightful and inspiring. Be sure to catch up on our upcoming episodes when we'll continue to explore topics that matter to you. And don't forget to follow us on Instagram, Blue Sky, or Facebook to stay connected and join the conversation. We'd love to hear your thoughts, so leave us feedback and let us know what you'd like to hear next. Thanks for listening and supporting our work.